long COVID. This refers to when individuals experience new or persistent symptoms 3 months or more after the initial COVID-19 infection. While we are still learning about the condition, we know that it can impact both adults and children, regardless of the severity of symptoms experienced during the initial infection. Currently, the most commonly reported symptoms include fatigue, cognitive problems, sleep disturbances, and shortness of breath, among other symptoms. As it takes time for a post-COVID-19 condition to be diagnosed, much of our current understanding of it comes from research conducted before the emergence of the Omicron variant in late November 2021. Studies from the pre-Omicron period suggest that approximately 30 to 40% of individuals who were not hospitalized for the initial COVID-19 infection still had one or more symptoms 12 weeks after the acute infection. That proportion may be even higher among people who were hospitalized during the initial COVID-19 infection. Evidence today also indicates a higher prevalence of post-COVID-19 condition among females compared to males. One of the ways we're seeking to bolster the evidence base is through surveys, such as the Canadian COVID-19 Antibody and Health Survey. The Public Health Agency of Canada, Statistics Canada, and the COVID-19 Immunity Task Force launched the second cycle of the survey in April 2022, and the third cycle will launch this month. Its primary objectives are to estimate the prevalence of post-COVID-19 condition among adults in Canada and to provide information on risk factors, symptoms, including severity and duration, and impacts on daily functioning. If you receive an invitation to participate in this survey in the mail, I strongly encourage you to participate. Data collected through this initiative will not only help us improve our estimates, but will also help inform public health decision-making to support those affected by the longer-term effects of COVID-19 infection. For now, we know the best way to reduce the risk of post-COVID-19 condition is to avoid getting a COVID-19 infection. And early evidence suggests that vaccination with 2 doses of COVID-19 vaccine may help reduce the risk of developing post-COVID-19 condition if you subsequently become infected. If you are experiencing new or lingering symptoms months after a COVID-19 infection, please know there is help available. Reach out to your healthcare provider or local health resources who can help you get the support you need and assist you in managing your symptoms. For more information and links to resources, visit the canada.ca webpage on post-COVID-19 condition, which also includes related links to a number of patient-led groups that you can reach out to for support. With COVID-19, other respiratory viruses and emerging issues like monkeypox being current concerns in Canada, it is reassuring to know that our COVID-19 protective practices can help reduce the risk of infection and spread for all these diseases. This means continuing with our good habits, like keeping recommended vaccinations up to date, remaining aware of disease activity in the local area, and continuing to take personal precautions, including staying home if you're symptomatic or test positive, improving ventilation, and continue to wear a mask in shared indoor or crowded spaces around people you don't live with. We continue to work with provinces and territories and partners to respond to the evolving monkeypox situation. At present, at least 550 confirmed cases of monkeypox have been reported from 30 non-endemic countries worldwide. In Canada, as of June the 3rd, 2022, 58 confirmed cases have been reported nationally, including 52 cases reporting from Quebec, 5 from Ontario, and 1 from Alberta. The risk of exposure to monkeypox virus is not exclusive to any group or setting. Anyone, no matter their gender or sexual orientation, could get infected and spread the virus if they come into close contact, including intimate sexual contact, with an infected person or then contaminated objects. We would be pleased to answer any questions on monkeypox today. Thank you. Merci, Megwich.
Bonjour à tous.
Good morning to everyone. Though SARS-CoV-2 is still circulating across the country, COVID-19 disease activity indicators, including daily case counts, lab test positivity, and wastewater signals, are continuing to decline in most areas of the country. Currently, hospitalizations remain elevated and variable, but severe illness trends are also declining in most areas. In addition to acute impacts of COVID-19 illness, the Public Health Agency of Canada continues to monitor current and emerging evidence on the longer-term impacts of COVID-19 infection, including post-COVID-19 condition, which is also known as long COVID. This refers to when individuals experience new or persisting symptoms 3 months or after their initial COVID-19 infection. While we are still learning about the condition, we know that it can impact both adults and children. And this, regardless of the severity of symptoms experienced during their initial infection. Currently, the most commonly reported symptoms include fatigue, cognitive problems, sleep disturbances, and shortness of breath, among others. As it takes time for post-COVID-19 condition to be diagnosed, much of our current understanding of it comes from research conducted before the emergence of the Omicron variant in late November 2021. Studies from the pre-Omicron period suggest that approximately 30 to 40% of individuals who were not hospitalized for their initial COVID-19 infection still had one or more symptoms 12 weeks after their acute infection. That proportion may be even higher among people who were hospitalized during their initial COVID-19 infection. Evidence to date suggests a higher prevalence of post-COVID-19 condition among women compared to men. We are looking to reinforce data through the Canadian COVID-19 Antibody and Health Survey. The Public Health Agency of Canada, Statistics Canada, and the COVID-19 Immunity Task Force launched the second cycle of this survey in April 2022. The third cycle will launch this month. Its primary objectives are to estimate the prevalence of post-COVID-19 condition among adults in Canada and to provide information on risk factors, symptoms, including severity and duration, and impacts on daily functioning. If you receive an invitation to participate in this survey in the mail, I strongly encourage you to participate. Data collected through this initiative will not only help us improve our estimates, but will also help inform public health decision-making to support those affected by the longer-term effects of COVID-19 infections. For now, we know that the best way to reduce the risk of COVID-19 condition is to avoid getting COVID-19. And early evidence suggests that vaccination with 2 doses of the COVID-19 vaccine may help reduce the risk of developing post-COVID-19 condition if you are subsequently infected. If you are experiencing new or lingering symptoms months after a COVID-19 infection, please know that there is help available. Reach out to your healthcare provider or local health resources, and they can help you get the support you need and assist you in managing your symptoms. For more information and links to resources, visit canada.ca on post-COVID-19 condition, which also includes related links to a number of patient-led groups that you can reach out to for support. With COVID-19, Other respiratory viruses and emerging issues like monkeypox being current concerns in Canada, it is reassuring to know that our COVID-19 protective practices can help reduce the risk of infection and spread of all of these diseases. This means continuing with our good habits like keeping recommended vaccinations up to date, remaining aware of disease activity in the local area, and continuing to take personal precautions, including staying at home if you're symptomatic or test positive, improving ventilation, and continuing to wear a mask in shared indoor or crowded spaces around people you don't live with. We continue to work with the provinces and territories and partners to respond to the evolving monkeypox situation. At present, at least 550 confirmed cases of monkeypox have been reported from 30 non-endemic countries worldwide. In Canada, as of June 3, 2022, 58 confirmed cases have been reported nationally, including 52 cases reported in Quebec, 5 in Ontario, and 1 in Alberta. While the risk of infection is considered to be low, the risk of exposure to monkeypox is not exclusively related to any group or setting. Anyone, no matter their gender or sexual orientation, could get infected and spread the virus if they come into close contact, including intimate sexual contact with an infected person or their contaminated objects. We would be pleased to answer any questions on this today. Thank you, Miigwech.
Thank you very much, Dr. Tam and Dr. New. I would now invite participants to use the raise hand function. If you would like to ask a question, you can have one question and one follow.
I would like to invite participants who have a question to raise their hand.
From CBC.
Hello, good morning. What type of modeling are we doing in Canada when it comes to assessing, where monkeypox infections will be in the next coming weeks, coming months? And if we're doing that already, is there any early results you can share with us, Dr. Tam?
Thank you very much, David. And I know people got used to modeling for COVID-19, so that's a very natural question. At the moment, there's not enough clarified data points to do any significant modeling, but our modelers are tracking all the parameters and they're ready to do more. But I think it's just some of the variables are not well characterized. At the moment, the most important thing is to get the epidemiology from the local public health departments just to verify the critical epidemiologic parameters.
Okay, thank you for that. I'm just wondering, your role is primarily to provide advice to the federal government. If I've understood your role the last couple of years, Dr. Tam, what advice are you providing to politicians, to public health authorities at this point in time, at this juncture? What are we doing? What are we not doing? What do we need to start doing at this early stage of these scattered outbreaks that we're seeing?
Yes, I think it's really important to ensure that all decision makers get the actual information as we have it. So we are trying to provide that in working with local and provincial health units. So it's important for everyone to remember that public health happens locally. They need the capacity that they need to carry out these investigations. It's important to know and characterize the current situation as an evolving one. There's many things that we don't know as yet. We have information based on what we know from the behavior of this virus in endemic countries, but we don't know well enough about what it would do in non-endemic countries. It's a neglected tropical disease. We need to have better international collaboration and support in order to collectively learn together globally. And so that's why we've been participating in the expert meetings of the WHO, as well as convening our own domestic expertise. It is important to learn from the HIV experience and learn to involve communities right at the start that are most impacted. And as such, we're advising our decision makers that we need to do a really good job. And we are trying to do that now, have been doing in connecting with stakeholder groups in the risk that's in the people most impacted at the moment, and sharing information, giving them toolkits that they need to spread the information and on how to reduce the risk of transmission. I think at this point in time, it is important to act fast and urgently to stop the chains of transmission. At the moment, it hasn't gone much beyond the initial risk groups, but it could happen. And we need to be ready for that. And so these are the many things that we advise our minister about.
Thank you very much. Our next question will be from Pierre Sénano from La Presse Canadienne.
La Presse Canadienne. Hello, Dr. New, can you hear me? Yes, thank you. Dr. New, this is inaudible to the interpreter. Service will be interrupted.
Quand le Dr Boileau nous a rencontrés il n'y a pas tellement longtemps, il nous disait que la prévalence était très forte chez les hommes qui ont des relations sexuelles avec d'autres hommes. Qu'est-ce que...
The question is about monkeypox and prevalence in homosexual communities of male gender. Thank you for the question. I think we're all on the same page. Everyone is susceptible to this virus. We don't have mass immunity against this virus. We stopped having smallpox vaccines in the 70s, and there are generations of young people who are not vaccinated against this. I think it's important to raise awareness among the whole population. But with what's going on in Quebec, certain people in certain groups are more susceptible. This situation is evolving. It is important for us in the public health field to raise awareness among the entire population so that they can understand their risk and protect themselves against this virus. But we also need to work with organizations and stakeholders in the field to raise awareness and share more information among groups that are currently at a higher risk. For example, we had a meeting within the agency and representatives with groups that have a lot of information on how to share information and how to contact the people that are at greater risk. We're working with people who have worked in the field of HIV to learn from their past experiences. Working with this organization will help us reach the people that are more affected currently. We're continuing to explore other options. We learned many lessons with COVID-19. We have to appeal to community leaders. We can use applications, for example, dating apps, that can be used to disseminate information. We're currently exploring many options to reach the higher risk population, but the general population as well. Follow-up question. Can you elaborate on that? Can you talk about vaccinations? Can you talk to us about people who received a variola vaccine in the 70s and those who didn't? Currently, does a smallpox vaccine that was obtained before the 70s and those after, what's the difference? How can we talk about vaccination? The interpreter alerts the audience to the fact that the sound is inadequate for interpretation and service will be interrupted.
C'est plus les personnes plus âgées qui ont eu une vaccination contre la variole avant. Mais je pense en général, il faut peut-être avoir comme la position perspective que tout le monde est susceptible et tout le monde qui peut-être est déjà comme exposé actuellement, il a un risque peut-être d'avoir le virus et peut-être même pendant une période d'incubation. Peut-être que c'est un autre outil d'offrir le vaccin. Donc, je pense que c'est ça ce qui se passe actuellement au Québec. On a eu des bonnes discussions avec nos homologues de Québec. On a déjà livré, je pense, 1000 doses au Québec. Et eux, ce que je comprends sur le terrain, c'est une combinaison avec, comme dit, le protocole standard. On fait un suivi des contacts. Si on a un cas confirmé, on va offrir le vaccin aux contacts étroits. Mais également, il y a aussi peut-être des événements et aussi des endroits aussi qui on a identifié peut-être comme des places ou des endroits où peut-être on a des contacts, c'est plus difficile à identifier. Donc, je pense que le Québec commence à aussi offrir peut-être le vaccin aux gens qui ont peut-être fréquenté ou peut-être été à un certain endroit ou événement dans un certain point au passé. Donc, je pense qu'on continue au Québec, mais aussi peut-être c'est quelque chose à considérer pour le reste du pays d'utiliser une combinaison parce que, comme le Dr. Tam a constaté, ça, c'est le moment propice. Il faut vraiment, vraiment briser les chaînes de transmission. Il faut utiliser tous les outils à notre disposition.
Merci. Our next question will come from Adam Hercules from the New Brunswick Telegraph Journal.
Hi there. Thanks for taking our questions. New Brunswick's health minister reported a first suspected case of monkeypox in New Brunswick yesterday, but public health in the province then said this morning that it was confirmed to be negative. That said, officials added that the person wasn't assessed until after their symptoms faded. And then meanwhile, the patient's travel history and clinical photos suggested it was a case. I wanted to know if you have any information on this, and do you believe there has been a spread of monkeypox to the Atlantic region?
Thank you for the question. We have no confirmed cases in New Brunswick or in the Atlantic region at this point, but I think it's really important that awareness increases. So it is helpful for people and journalists to make sure the population understands the condition and what we're dealing with. There are, of course, some other diseases that have rashes and could potentially look like monkeypox, and that's why you need a laboratory diagnosis. And we provided, guidance out to the provinces and others on how to take samples and how to get those samples diagnosed. But the confirmed cases are based on an actual laboratory confirmation. And as far as I know, there's been no cases to date.
Thank you. Follow up, has public health distributed any smallpox vaccine to Atlantic Canada? How much and where?
So we have messaged the provinces that if they need to have vaccines prepositions, we are ready to help. So this is a bilateral discussion between each of the jurisdictions. We can get vaccines to them pretty fast, but it is good to have some prepositions. So those conversations are ongoing. As far, Dr. New, I don't know if you have any further information about the Atlantic region.
No, it's Dr. Newitt. Nothing additional to add. It's a very live conversation. Certainly, we've engaged with all of the provinces and territories, and to varying degrees, depending on sort of readiness to accept. Looking at the logistical chain in terms of how quickly we can get the vaccines there. It's a combination of all those factors that obviously our program staff are obviously discussing with their counterparts in each of the provinces and territories. Thanks.
Thank you. Our next question will come from Melissa Trepanier from
Melissa Trepanier, Radio-Canada. I would like to talk about COVID-19 and the pressure on the tourism and hospitality industry. We're talking about random testing. Is it still relevant? Unfortunately, the sound quality is inadequate for interpretation. Service will be interrupted.
C'est beaucoup diminué. C'était le cas avec les autres vagues et toujours pendant nos étés, il y a moins de transmission. Mais par contre, il faut toujours être prêt à surveiller parce qu'on voit toujours, même partout dans le monde, il y a toujours la possibilité d'avoir, comme il dit, une variante préoccupante. Donc, je pense que c'est important avec un système à nos frontières d'être capable, avec notre surveillance, de détecter s'il y a une variante préoccupante qui peut rentrer au Canada. Donc, je pense que pour l'instant, c'est important d'avoir un système. C'est pas tous les voyageurs, mais seulement, comme on dit, d'une façon aléatoire, on continue de dépister afin d'être capable de faire un séquençage génomique pour détecter une variante préoccupante. Mais c'est toujours, on continue à surveiller la situation ici au Canada, mais aussi à travers le monde, et on est toujours prêt à modifier, adapter avec les données probantes.
Mais scientifiquement, est-ce que ces tests, qu'est-ce que ça donne concrètement? Est-ce qu'ils ont toujours un impact?
Oui, parce que si on a des échantillons des voyageurs et aussi on sait d'où les voyageurs viennent, c'est important parce qu'avec les séquençages, si on peut-être par exemple on trouve il y a peut-être nouveaux variants préoccupants, peut-être c'est aussi une question peut-être même pour signaler aux autres pays. Peut-être ici au Canada, peut-être on est le premier pays à détecter une variante préoccupante d'un voyageur qui vient d'un certain pays. C'est fait partie de notre collaboration aussi collective à travers le monde parce que nous autres, on est en contact étroit avec nos homologues des autres pays et c'est une question un bon échange d'informations si on trouve peut-être un variant préoccupant d'un pays ou l'autre.
Thank you. Our next question will come from Karen McKinley, who I believe is from the Brandon Sun.
Good morning, and thank you so much for taking our calls. I was just wondering, we've had some issues with unreliable data, especially here in Manitoba, and it's constantly being tweaked. So I'm just wondering, does that affect maybe the federal tracking of COVID cases?
Thank you for the question. And once again, I just want to emphasize that we need to continue to support the public health system in terms of data acquisition and sharing. And we can't, suddenly the pandemic, people perceive it as being over when it's not, and then down tooling on the support and the resources to provide that information. I think that, as we all know, we're doing surveillance monitoring to look at trends and making sure that we have enough samples for that. We're not detecting every case, as everyone can imagine, but we want to get enough information, enough samples, enough epidemiologic data so that trends can be managed. And in some ways, that's why we've been increasing wastewater surveillance, for example, if, of course, people are not getting tested or diagnosed. But I know that, there may be, I don't actually know the specific details in relation to the province that you're talking about, but we're always there to try and facilitate and support them as needed in terms of getting their data system supported as well. But yeah, I mean, there's a lot of recommendations. I think if people have not read the Pan-Canadian Health Data Strategy and the recommendations of the External Advisory Group, they should, because we do need a lot more support for the public health system and the data infrastructure.
Okay, thanks for that. And maybe just a quick follow-up in terms of vaccines for the monkeypox. You've already said that there have been talks with Atlantic Canada, and have there been any other areas that the government has been monitoring outside of Quebec and Ontario?
Absolutely, yes. So this is a countrywide monitoring and alerting approach. So we convened all the chief medical officers, the special advisory committee, and have connected with every jurisdiction, shared case definitions, how to report cases, and laboratory capacity development so that samples don't have to necessarily be sent to microbiology lab in the National Microbiology Lab in Winnipeg. So all of this is being rapidly increased in terms of our capacity, but every jurisdiction needs to be on alert and look out for cases, and they are following them up. As you've seen, there are cases being ruled out too. So I think the system is working, but we need everybody to collaborate, including the public, if they think they may be a contact, if they think they have symptoms. And so every province and the discussion about vaccines and vaccine pre-positioning is being done with every jurisdiction.
Thank you, Dr. Tam. Our next question will come from Olivier Ferron-Boisé from TVA.
The question is from TVA. I would like to talk about monkeypox. Specifically in Montreal and Quebec, the number of cases doubled in 2 weeks. You're talking about breaking the chains of transmission. What is required for us to avoid doubling cases in the next week? What do we need to do? Will we be able to contain cases with these measures? You've mentioned vaccination. Will this be enough to break these transmission chains? Thank you for the question. This is a question a phenomenon we're seeing in the scene. It's important to ask the questions to health authorities in Montreal and Quebec. Federally, we're ready to provide support through vaccination. I've had many conversations with Dr. Boileau in Quebec. We're all on the same page. We have to break the chains of transmission through vaccination. Quebec will continue with its vaccination strategy that is being offered to close contacts. Through their investigation, we also found that there were places and events that could have led to contacts that have been hard to identify. They're considering offering the vaccination to events and spaces that are involved. We have to use all of the tools at our disposal. For me and everyone in Quebec, this is a concerning situation. Most cases, the concern here is that there are some cases that can be identified identified within families, pregnant women, or young children are particularly concerning. Consequences could be graver for these two groups. So at this time, we have to use all of the tools at our disposal. Quebec is doing its best, and we are helping them where possible. As a follow-up, I'd like to talk about COVID-19. You've talked about mandatory vaccination for public servants. Is there scientific justification for this mandatory vaccination and for it to be maintained? What will we need to lift this mandatory vaccination? Thank you for the question. I can tell you that there are two aspects to your question. If we talk about data and scientific evidence, we've shared with other experts within the agencies, and we have assessed the situation, which is constantly evolving. We've assessed the efficacy of 2 doses, what's going on with people who have been infected with the Omicron variant, what is the herd immunity among the general population? How long does immunity last? There are many factors to be considered. It's complex. This is our responsibility to provide scientific evidence to the decision makers. From there, a decision about vaccination mandates for public servants or other groups is a decision that will be made by decision makers. You can appreciate that this is a difficult decision to make, but it's important to distinguish between what Dr. Tam and other experts have as a responsibility. We offer scientific data for decision makers and cabinet. They consider this data, but they also have other considerations that they might take into account before making a decision.
Going to ask a couple questions from the moderator's chair, but before I do that, if anybody who has not asked a question would still like to, please raise your hand, and we might have a bit of extra time for second questions if others would like to raise their hand again. But my first question, I think, is about the 4th dose rollout for COVID. There's different recommendations in different provinces. I'm just wondering, from your perspective, Dr. Tam, when the best timing would be to have 4th doses for sort of the general population, not high-risk populations, and if you think that that time has happened now, or if there's a time in the future you think that wouldn't be a better time to roll those out.
Mm-hmm. Thank you for the question. And I think the National Advisory Committee on Immunization provided recommendations on the 4th dose, which is focused mainly on the high-risk groups. And some jurisdictions have, determined what those groups are based on their own sets of circumstances, but also opening up the opportunity for others. But it is more focused on those at the highest risk, some of whom received their first booster, quite a while back. Now, I think the timing of a booster is important to consider. Because as provinces were opening up for the 4th dose, we were very much in the second Omicron curve, second Omicron wave, or I guess in many jurisdictions, the 6th wave, which impacted the way that people are urging to get their 4th dose. I think what we are trying to plan with the provinces right now is the fall, so that we can't anticipate necessarily when the next variant might appear that is, can cause another wave. We know something about waning immunity now, but it's our best sort of estimate that, as usual, respiratory viruses could go up in the fall-winter timeframe. So I think our efforts are now focused particularly on the 4th dose or beyond to that timeframe. But at this point in time, though, anyone who hasn't got their first booster should consider getting that to reinforce their immunity, because the Omicron variant really has showed us that that 3rd dose is important.
Thank you. And on the monkeypox vaccine, I'm curious how you see those vaccines being used. I mean, we're not doing a wider scale vaccine of the population, and where our procurement of that vaccine sits. If we have enough, do we have to buy more to do what you think is necessary with that particular vaccine?
Yes, I think as everybody can appreciate, there hasn't really been a vaccination campaign for monkeypox really before this. People were getting vaccinated perhaps if they were working in a lab or other high-risk situation where they may encounter the virus. It is not used routinely in Africa, for example. The current situation is unusual, as we've said, and it needs urgent attention, but is currently, and I'm not saying that would stay, but it currently involves a specific group of individuals that have close, intimate sexual contact. So that's the group that we're focusing on at the moment. And there's no sort of essential recipe or blueprint for a monkeypox vaccination. We're trying to learn from other experiences, for example, with smallpox, and learn from the international collective from what we should do. But for now, it's really focused, as Dr. New said in French, on those who may have the highest risk of exposure, the intimate, close contacts. And at this point in time, I think that is manageable, and we want to keep it manageable and break those chains of transmission. And we need the public and others to collaborate to help local public health do that. Of course, we're having further discussions, as are many countries, with the manufacturers to see what can be done about further acquisition. But that's where things are at the moment. But just to remind everyone that the chains of transmission can be broken by non-pharmaceutical means on the whole. I think the difficulties right now is that it's very difficult to do contact tracing in the group most impacted, and therefore the offer of vaccination might become broader and related to certain exposure settings as opposed to individual contact tracing.
Thank you. I think we have another question from Pierre Saint-Arnaud from La Presse Canadienne.
Pierre Saint-Arnaud, La Presse Canadienne. The interpreter would like to alert the audience to the fact that the sound is inadequate for interpretation and service will be interrupted.
Et que vous commencez à avoir des cas qui sont en dehors des groupes identifiés. J'aimerais que vous soyez un petit peu plus précis parce que après les 2 années de pandémie, là, c'est clair que les gens n'aiment pas entendre parler là, évidemment d'une autre possible pandémie. Et juste qu'on clarifie, là, c'est pas là qu'on est parce que la variole simienne, si je comprends bien, n'est pas du tout, mais même pas proche d'être aussi transmissible que la COVID.
Oui, merci pour la question. Oui, effectivement, si on compare la variole simienne avec la COVID-19, la COVID-19 est plus transmissible parce qu'on sait avec les aérosols aussi, c'est vraiment une maladie, comme on dit, respiratoire. Et la variole simienne, c'est plus une question avec, comme on dit, un contact étroit avec peau à peau, peut-être avec les fluides corporels et tout ça. Donc, je pense que c'est pas la même situation, mais on est en train encore d'apprendre parce que on sait aussi au passé avec notre base de connaissances, c'est aussi peut-être les gouttelettes respiratoires. Donc, je pense qu'il faut rester toujours ouvert avec les modes de transmission. Peut-être le virus a évolué, mais jusqu'à jour, à date, avec qu'est-ce qui se passe ici au Canada, mais aussi à travers le monde, dans les pays, comme il dit, où il y a des cas de variole simienne, ou les pays non endémiques. C'est une question de continuer de faire un bon échange d'informations. Aussi, il y a beaucoup de questions scientifiques. L'OMS a même organisé une séance scientifique pour discuter les questions scientifiques. Donc, je pense que Actuellement, c'est pas la même situation, c'est pas comme une pandémie comme la COVID-19, mais on voit avec plusieurs pays maintenant impliqués, c'est quelque chose à suivre, c'est sûr.
Okay. Mais vous avez parlé de cas avec des femmes enceintes. Je suis un peu curieux de savoir, est-ce qu'on a des cas documentés là, de femmes enceintes et quelle est l'implication pour une femme enceinte de contracter la variole simienne?
Non, je sûrement pas, peut-être pas préciser. On n'a pas des cas confirmés avec les femmes enceintes, mais pour moi et aussi pour toutes les autorités de la santé publique, c'est une préoccupation. Si on a peut-être des cas parmi les femmes enceintes ou même les jeunes enfants, on sait avec notre base de connaissances qu'on peut avoir les conséquences plus graves. Par exemple, je peux peut-être montrer l'exemple avec la varicelle. Le varicelle, normalement, c'est une maladie d'enfance. Tout le monde peut-être connaît quelqu'un qui a eu le varicelle. Si une femme enceinte est contaminée, peut-être juste avant l'accouchement avec la varicelle, ça peut être très grave pour la femme avec des conséquences médicales pour la femme lui-même et aussi pour le bébé, le fœtus, parce qu'on peut même avoir comme des conséquences très graves, je peux sûrement vous dire ça. Donc, peut-être, par exemple, c'est ça la préoccupation pour la variole simienne, si on utilise aussi même l'exemple qu'on comprend bien avec la varicelle.
Merci beaucoup.
Thank you. And I think possibly Rafi Wujikanyan from CBC is on the line and has a question. Rafi, are you there?
Yes, I'm here. Can you hear me?
Yes, we can.
Okay, great. Dr. Tam, I'm just wondering, you're talking to people about, not getting infected by COVID-19. That's the best way to avoid post-infection symptoms. At the same time, the Public Health Agency of Canada is stopping the distribution of rapid tests to provinces and territories. And those are right now the best ways for a lot of people to determine if they have COVID, since PCR tests are no longer widely done in provinces and territories. So why are you taking away rapid tests?
I think rapid tests do play a role, but of course, primary prevention is the best, layering on those protections, including masks and etc. when you're in close contact with others not in your household. So I do think rapid tests could continue to play a role, and that's important, but it's not the only means. I think rapid tests can potentially change people's behavior if they get a positive test. Although, as we all know, a negative test doesn't mean you don't have it, and that those other measures would also be extremely important to continue these personal habits. So I think I am not personally involved in the exact amounts being provided to provinces and territories, but at this stage in the pandemic, I think some of the roles and responsibilities are reverting back to the provincial jurisdictions.
Okay, thanks. And as a follow-up, just with the spread of another infectious disease globally so soon after COVID-19, is global public health broken, and how do we fix that?
Well, I think it is emerging infectious disease can always hit us, and we should be as prepared as we can, which means reinforcing the global public health capacity. So we're only as strong as our weakest link, and capacitating every country to a reasonable level is really important. So I think that, as I said, global collaboration and global capacity building is, I think, our best measure against future infectious diseases. We may see more, and I'm not necessarily because of the capacity not being there, but it's just the fact that due to a number of factors, including climate change, there's an increase in human-animal interface and context. And so reinforcing these capacities are really important right now. I think we'll see an increase in numbers of these types of emerging infectious diseases. And with good capacity, not just in Canada, but globally, we can help to manage them and reduce their impact as much as possible. So there's definitely gaps. I think you've seen some of the reports globally, and some of the efforts at the last the WHA, the World Health Assemblies just passed, is about how we strengthen the global public health capacity.
Thank you very much, Dr. Tam and Dr. New. Seeing no additional questions on the line, that will end today's press conference. Everybody have a great day.
Thank you very much.
Great. Have a good weekend, everyone.